How often do you pay attention to subtle changes in your body? What if these small signs were your body's way of telling you something important, something life-saving? This video is for anyone who wants to take charge of their health, particularly men over 40 or those with a family history of prostate issues. By watching this video, you'll gain the knowledge to recognize early warning signs of prostate cancer, which could make all the difference in early detection and treatment success. This isn't just another video listing symptoms. Here, you'll get practical insights, strategies to monitor your health, and clear guidance on what steps to take if you notice any of these signs. So stay with us till the end. This knowledge could save a life, maybe even yours. Before we dive in, help us reach more people by liking and sharing this video. And don't forget to subscribe and ring the bell icon for more health-related content designed to empower you. The information provided in this video is for educational purposes only and should not be considered as medical advice. Please consult a healthcare professional for any concerns regarding your health. Early detection is crucial, but a doctor's evaluation is necessary for an accurate diagnosis and appropriate treatment. Frequent urination, a subtle yet significant early warning. Have you found yourself waking up multiple times during the night just to use the bathroom? This seemingly small inconvenience could be more than a normal part of aging. It might be an early warning sign of prostate issues, including prostate cancer. Frequent urination, particularly at night, a condition called nocturia, is one of the most common and earliest symptoms that something might not be right with your prostate. Why does this happen? The prostate gland, located just below the bladder, surrounds the urethra, the tube through which urine exits the body. When the prostate enlarges, it can press against the bladder and urethra, causing irritation and a reduced capacity for urine storage. This results in a frequent urge to urinate, even if the bladder isn't full. In the case of prostate cancer, the tumor may grow and begin to obstruct normal urinary flow, leading to increased trips to the restroom. While this isn't always cancer, it could also indicate benign prostatic hyperplasia, BPH. It's vital to pay attention to changes in your urinary habits and seek medical advice. How to recognize the signs: increased nighttime urination, waking up 2 or more times a night to urinate, urgency, a sudden, strong urge to urinate, making it difficult to delay, frequent daytime urination, needing to visit the bathroom more often than usual during the day. Practical strategies to address frequent urination. If you're experiencing frequent urination, these actionable steps can help you manage the symptom while seeking professional guidance. Keep a diary. Track your urination patterns, including how often you go, how much urine you pass, and any accompanying symptoms. This information will be valuable for your healthcare provider. Limit fluid intake. Before bed, avoid drinking large amounts of fluids in the evening, especially caffeine and alcohol, which can irritate the bladder. Perform pelvic floor exercises. Strengthening pelvic floor muscles can help improve bladder control. Visit a healthcare provider. Consult your doctor for a thorough evaluation. Early diagnosis can make a significant difference in treatment outcomes. When to take action. Frequent urination might seem like a minor annoyance, but if it's persistent or accompanied by other symptoms like pain, blood in the urine, or difficulty starting urination, don't delay. Early detection is key to effective treatment. Difficulty starting urination, a sign you shouldn't ignore. Have you ever stood over the toilet feeling the urge to urinate but struggling to start? This condition, known as urinary hesitancy, is more than just an occasional inconvenience. It could signal an issue with your prostate. Whether it's an enlargement, obstruction, or a more serious concern like prostate cancer, difficulty starting urination deserves attention. Why does this happen? The prostate gland, situated near the bladder and urethra, can become enlarged due to various factors, including benign prostatic hyperplasia, BPH, or prostate cancer. When this happens, it can obstruct the flow of urine through the urethra, making it harder for the bladder to empty efficiently. Over time, this can strain the bladder muscles and lead to more severe urinary issues. How to recognize difficulty. Starting urination. Hesitation, a noticeable delay between the urge to urinate and the actual flow of urine. Weak stream, the urine stream starts but lacks pressure, flowing slowly or intermittently. Straining, the need to push or strain to initiate. Urination, while occasional hesitancy might result from dehydration or stress, persistent symptoms are a red flag. Practical strategies to address hesitancy. If you're struggling to start urination, these steps can help manage the condition while you seek medical advice. Stay hydrated but balanced. Drink enough water throughout the day to prevent dehydration, but avoid overhydrating, especially before bed. Practice double voiding. After you've urinated, wait a few moments and try again. This helps ensure the bladder is emptied. Avoid holding urine. Delaying urination can worsen the problem and place additional strain on the bladder. Use relaxation techniques. Stress and anxiety can exacerbate hesitancy. Deep breathing or pelvic floor exercises may help relax the muscles involved in urination. Seek medical advice. If difficulty persists, consult a healthcare provider to rule out serious conditions like BPH or prostate cancer. Why early action matters. While difficulty starting urination might seem manageable in the short term, it's often a sign of underlying problems that can worsen if left untreated. Early evaluation and intervention can improve quality of life and, in cases of prostate cancer, significantly impact outcomes. Weak urine stream, a clear warning signal from your prostate. Have you ever noticed that your urine stream has become noticeably weaker or more sluggish over time? What used to be a steady and strong flow of urine may now seem intermittent, weak, or even struggle to get started. While occasional fluctuations in urine flow are normal, a consistently weak urine stream can be a serious sign that something's wrong with your prostate. Why does this happen? The prostate, a walnut-sized gland, located just below the bladder, surrounds the urethra, the tube through which urine exits the body. When the prostate becomes enlarged, whether due to benign prostatic hyperplasia, BPH, infection, or in some cases cancer, it can press against the urethra, creating a blockage that restricts the flow of urine. As the urethra becomes more constricted, the force of the urine stream decreases, and the bladder may have to work harder to expel urine. How to identify a weak urine stream reduced flow? Urine comes out in a very thin stream or dribbles, compared to the usual forceful flow you may have had before. Intermittent flow, the stream may start strong but then sputter or stop, requiring you to wait or even push to continue. Prolonged urination. It may take much longer than usual to fully empty your bladder, with the weak stream contributing to this delay. Why this shouldn't be ignored. While weak urine flow is a common symptom of BPH, it can also be an early sign of other prostate-related issues, such as an infection, bladder stones, or even prostate cancer. Ignoring the symptom or assuming it's just a natural part of aging can allow the condition to worsen. What you can do about it. If you're experiencing a weak urine stream, here are some strategies to help alleviate the issue and seek the right treatment. Monitor fluid intake. Staying hydrated is important, but drinking too much at once can overwhelm your bladder. Spread your water intake throughout the day. Use the bathroom regularly. Don't hold urine for long periods. Frequent urination can help reduce strain on your prostate and bladder. Try pelvic floor exercises. Strengthening the pelvic floor muscles can improve bladder control and reduce pressure on the prostate. Consult a doctor. If the weak stream persists, make sure to see a healthcare provider for a thorough evaluation. Tests such as a prostate exam, ultrasound, or urine flow studies may be needed to identify the cause. Why early intervention matters. A weak urine stream isn't just an annoying symptom, it can be the sign of a more serious condition that requires attention. If the prostate is enlarging or if there is a blockage, early intervention can prevent further complications, such as urinary retention, bladder infections, or kidney damage. In cases of prostate cancer, early detection is crucial for successful treatment. Painful or burning urination. A red flag for prostate health. Have you ever experienced a painful or burning sensation when urinating? It's an uncomfortable and unsettling feeling that can often signal something's not right with your urinary system. If you're noticing this symptom, it's essential to pay close attention, as it could be a sign of prostate irritation, infection, or even a more serious prostate issue. Why does pain or burning happen during urination? The prostate is an essential part of the male reproductive and urinary systems, and it's located just below the bladder, surrounding the urethra. When the prostate becomes inflamed, whether due to prostatitis, inflammation of the prostate, a prostate infection, or benign prostatic hyperplasia, BPH, it can irritate the urinary tract, causing a sensation of pain or burning while urinating. In some cases, the discomfort can also be due to an infection in the urinary tract, UTI, or a sexually transmitted infection, STI, that affects the prostate or urethra. Regardless of the cause, painful or burning urination is a symptom that should not be ignored. How to recognize painful or burning urination. Burning sensation. A sharp stinging or burning feeling when you urinate, especially at the beginning or end of urination. Painful urination. A dull, aching pain or a sensation of pressure that accompanies urination. Increased frequency with discomfort. You may feel the need to urinate more often, but each time you do, it's painful or accompanied by a burning sensation. Discomfort. After urination, the pain or burning may continue even after you've finished urinating, or you may notice a lingering discomfort in your lower abdomen or groin area. Why you shouldn't ignore painful urination. Painful or burning urination is not only uncomfortable, but it can also be indicative of a serious issue. While it could be a sign of something as mild as a UTI, it may also indicate prostate inflammation, prostatitis, a bacterial infection of the prostate, or even prostate cancer in its later stages. Ignoring this symptom can lead to worsening pain, potential urinary retention, or increased risk of spreading an infection. In the case of prostatitis or an untreated infection, the situation can worsen rapidly, requiring more intensive treatment. What you can do about it. Stay hydrated. Drink plenty of water to help flush out toxins and prevent dehydration, which can worsen irritation. Avoid irritants. Reduce or eliminate the consumption of caffeine, alcohol, or spicy foods, which can sometimes irritate the urinary tract and exacerbate discomfort. Practice good hygiene. Ensuring proper hygiene can help prevent urinary tract infections and reduce irritation. Consult a healthcare provider. If you experience persistent pain or burning during urination, it's crucial to see a healthcare provider. They may perform a prostate exam, urine culture, or blood tests to identify the cause of the discomfort. Treating the underlying issue early can prevent complications and promote faster recovery. Why early detection and treatment matter. Whether it's an infection, inflammation, or something more serious, addressing painful urination as soon as possible is crucial for maintaining good prostate health. For example, early treatment of prostatitis can prevent it from becoming chronic and causing long-term complications. If the issue is prostate cancer, early detection is vital for effective treatment and a better prognosis. Painful urination is a clear warning sign that shouldn't be dismissed. By seeking medical attention, you're taking the first step toward ensuring your prostate remains healthy and functioning optimally. Blood in urine or semen, a serious signal for prostate health. Imagine you're going about your day when you notice something alarming, blood in your urine or semen. This is not something anyone should ignore, as it can be a red flag for prostate issues ranging from inflammation to more serious conditions like prostate cancer. What does blood in urine or semen mean? When blood appears in your urine, hematuria, or semen, hematospermia, it's often an indication of a problem with the prostate, urinary tract, or reproductive system. Although there are various potential causes, the presence of blood is always something that should prompt immediate medical attention. The prostate is located near the bladder and urethra, so when there's an issue with the prostate, it can affect these nearby structures, leading to blood appearing in the urine or semen. Common causes of blood in the urine or semen related to the prostate include prostate inflammation, prostatitis. Inflammation of the prostate can lead to blood in the urine or semen due to the irritation of blood vessels near the prostate. Benign. Prostatic hyperplasia, BPH. An enlarged prostate can cause pressure on the urinary tract and result in bleeding, especially when urinating. Prostate infection or abscess. Infections in the prostate can damage blood vessels, leading to blood in the urine or semen. Prostate cancer. Although less common, blood in the urine or semen can be a sign of prostate cancer, particularly in the later stages, when the cancer has spread or caused significant damage to the prostate. How to recognize blood in urine or semen. Blood in urine, hematuria. If you notice a pink, red, or brownish tint to your urine, it could be due to the presence of blood. Sometimes the blood might only be visible in the toilet after urination, or in the toilet bowl, but other times it could be seen in the urine itself. Blood in semen, hematospermia. The presence of blood in semen may be noticed during ejaculation. The semen might appear pink, red, or brownish due to the blood content. Other symptoms to watch for. Along with the blood, you may experience other symptoms like pain or discomfort during urination or ejaculation, frequent urination, or a weak urine stream. Why blood in urine or semen should never be ignored. While there are cases where blood in the urine or semen could be linked to benign conditions like a recent infection or inflammation, it is always a serious symptom that requires medical evaluation. In some cases, blood in the urine or semen can indicate an underlying more serious condition, such as prostate cancer or other prostate disorders. Prostate cancer. Although it's often asymptomatic in the early stages, prostate cancer can lead to bleeding as the tumor grows or spreads. If blood in the urine or semen occurs in combination with other symptoms, like difficulty urinating or pelvic pain, it may suggest the need for a prostate exam. Prostatitis and BPH. While conditions like prostatitis and BPH may cause blood in the urine or semen, they are usually treatable when diagnosed early. However, delaying treatment could lead to worsening symptoms, increased pain, and the potential for long-term issues. What you should do if you notice blood. Seek medical attention immediately. If you notice blood in your urine or semen, don't wait. Consult your healthcare provider right away. They may perform tests such as a urinalysis, ultrasound, or a prostate exam to determine the cause of the bleeding. Undergo a prostate exam, a digital rectal exam, DRE, or a prostate-specific antigen, PSA, test might be recommended to assess the health of your prostate and rule out conditions like BPH. Prostatitis or prostate cancer. Stay calm but be proactive. While blood in urine or semen can be concerning, early detection and intervention can prevent complications. Trust your healthcare provider to guide you through the diagnostic process and provide you with the right treatment plan. Follow up regularly. After any initial treatment or diagnosis, make sure to schedule follow-up appointments to monitor your prostate health and catch any potential issues early. The importance of early detection. When it comes to prostate health, early detection and treatment are key to preventing complications and improving outcomes. Prostate cancer, for example, is highly treatable when detected in its early stages, and many cases of prostatitis or BPH can be managed with simple treatments and lifestyle changes. If you notice blood in your urine or semen, it's essential to take immediate action. This is a symptom that requires professional attention, and addressing it promptly can help you avoid long-term health issues. Erectile dysfunction, a potential warning sign of prostate health issues. Have you noticed difficulty achieving or maintaining an erection? This could be more than just a temporary issue. It could be a sign of a deeper problem related to your prostate health. What is erectile dysfunction, ED? Erectile dysfunction, ED, is the inability to achieve or maintain an erection sufficient for sexual intercourse. While it's common for men to experience occasional erectile problems, ongoing difficulty could point to underlying health issues, including problems with the prostate. The prostate is a small walnut-sized gland located just below the bladder, surrounding the urethra, and playing a crucial role in sexual function. It's responsible for producing seminal fluid, which helps nourish and transport sperm. When the prostate is not functioning properly, it can affect sexual performance and lead to erectile dysfunction. How prostate health and erectile dysfunction are linked. Prostatitis, prostate inflammation. Prostatitis is an inflammation of the prostate gland, often caused by bacterial infections. This condition can lead to pain, swelling, and difficulty urinating. Additionally, prostatitis can impair sexual function, leading to erectile dysfunction. The inflammation and discomfort associated with prostatitis can interfere with blood flow to the penis, making it difficult to achieve or sustain an erection. Benign prostatic hyperplasia, BPH. BPH, or prostate enlargement, is a common condition among older men. As the prostate enlarges, it can press against the urethra, disrupting urinary flow and sometimes leading to erectile dysfunction. BPH can also interfere with the balance of hormones and blood flow necessary for an erection. Prostate cancer. Erectile dysfunction is also a common concern for men diagnosed with prostate cancer. The disease itself, as well as its treatments, such as surgery, radiation, or hormone therapy, can interfere with the nerve pathways and blood flow to the penis, leading to difficulty achieving or maintaining an erection. Prostate cancer treatments can cause damage to the erectile tissue or result in lower levels of testosterone, the hormone that plays a key role in sexual function. Damage to nerves and blood vessels. The prostate is located near critical nerve pathways and blood vessels that control erections. If these nerves or blood vessels are affected by prostate disease or treatments, it can lead to erectile dysfunction. For example, surgery for prostate cancer often involves removing parts of the prostate that may be involved in sexual function, which can result in ED. Similarly, radiation therapy aimed at treating prostate cancer can damage surrounding tissues, including the nerves that are vital for erections. Other contributing factors. In addition to prostate issues, erectile dysfunction can be influenced by a variety of other factors, including hormonal imbalances. The prostate is involved in hormone regulation, and conditions affecting the prostate can disrupt the delicate hormonal balance necessary for sexual function. Circulatory problems. Since erections depend on healthy blood flow, conditions that affect the circulatory system, like high blood pressure or high cholesterol, can also contribute to ED. Psychological factors. Anxiety, stress, and depression are common psychological factors that can interfere with erectile function. The stress and worry related to prostate health issues can exacerbate erectile problems. What to do if you're experiencing erectile dysfunction? If you're having difficulty achieving or maintaining an erection, it's essential to address the issue with a healthcare provider. Here's what you can do. Consult your doctor. If you're experiencing erectile dysfunction, don't ignore it. Speak with your healthcare provider, who can help determine if your ED is related to prostate issues or another underlying cause. They may perform a physical exam, order blood tests, or suggest imaging tests to assess your prostate health. Prostate exam. Depending on your symptoms, your doctor may recommend a prostate exam, such as a digital rectal exam, DRE, or a prostate-specific antigen PSA test to assess your prostate health. If necessary, further tests like an ultrasound or MRI may be performed to rule out prostate cancer or other conditions. Treatment. Options. Treatment for erectile dysfunction varies depending on the underlying cause. If your ED is linked to prostatitis, BPH, or prostate cancer, addressing the root cause through medications, lifestyle changes, or procedures may help. Medications such as PDE5 inhibitors, e.g., Viagra or Cialis, can help improve erectile function. Additionally, addressing underlying conditions like hypertension or diabetes may also improve ED symptoms. Consider prostate health treatment. If prostate problems are the cause of ED, treatments such as antibiotics for prostatitis, medications for BPH, or therapies for prostate cancer, such as surgery or radiation, may be recommended. These treatments may improve your prostate health and, in turn, alleviate erectile dysfunction. Lifestyle changes. Adopting a healthy lifestyle can play a crucial role in improving erectile function. Regular exercise, a balanced diet, stress management, and avoiding smoking and excessive alcohol consumption can improve circulation, hormone levels, and overall sexual health. Counseling and therapy. If psychological factors like anxiety or depression are contributing to your ED, speaking with a counselor or therapist can be beneficial. Cognitive behavioral therapy, CBT, is an effective treatment for addressing the psychological components of erectile dysfunction. The importance of early intervention. Erectile dysfunction is often an early indicator of prostate problems, and recognizing this connection early can help you address both issues before they progress. Prostate diseases, like cancer or prostatitis, are highly treatable when caught in the early stages, and addressing erectile dysfunction early can prevent further complications and improve your quality of life. If you're experiencing difficulty achieving or maintaining an erection, don't hesitate to seek help. Your prostate health is a critical part of overall well-being, and addressing it proactively can help you maintain a healthy, active lifestyle. Pain in the lower back, hips, or pelvis, a warning sign of prostate cancer spread. Have you been experiencing persistent pain in your lower back, hips, or pelvis? This type of pain, especially when it lingers for weeks or worsens over time, could be a sign of something more serious than just general discomfort. Understanding the connection between pain and prostate cancer. Prostate cancer, especially in its later stages, can spread, metastasize, to other parts of the body, including the bones in the lower back, hips, and pelvis. These areas are particularly vulnerable to cancerous growth because of their proximity to the prostate, which is located near the spine and pelvic region. When prostate cancer spreads to these bones, it can lead to localized pain and discomfort. This pain is often described as dull, aching, or persistent, and it may become worse at night or with movement. It might start as mild discomfort and gradually intensify, making it difficult to find relief. If left untreated, the pain can significantly impact your mobility and quality of life. How does prostate cancer spread to the bones? Prostate cancer is one of the most common cancers to spread to the bones. When prostate cancer cells travel from the prostate to the bones, they tend to accumulate in areas with a high concentration of bone marrow, such as the lower back, hips, and pelvis. The cancer cells disrupt the normal bone structure and can lead to a variety of symptoms, including pain and tenderness in the affected areas. This process is known as bone metastasis. As the cancer cells invade the bone, they weaken it, increasing the risk of fractures or compression of surrounding nerves, which can lead to additional complications like numbness, tingling, or weakness in the legs. Symptoms of bone metastasis. Pain in the lower back, hips, or pelvis is often one of the first signs that prostate cancer has spread to the bones. However, bone metastasis can cause additional symptoms including localized tenderness. You may feel tenderness or discomfort when touching the affected area or when pressure is applied, such as while sitting or lying down. Pain that worsens over time. Pain that becomes more severe or persistent, especially at night or during periods of rest, can be a red flag. It may also intensify when you try to move, bend, or lift objects. Reduced range of motion. The pain and discomfort may limit your ability to move freely. For example, you might find it difficult to bend over or perform everyday activities due to stiffness and pain in the affected areas. Bone fractures. In some cases, the cancerous cells weaken the bones to the point of fractures, which may occur even with minor injuries or movements. Why does pain in the lower back, hips, or pelvis occur? The lower back, hips, and pelvis are particularly sensitive to prostate cancer spread because these areas contain many vital structures, including bones, nerves, and blood vessels. The prostate is located near these regions, making it a common site for cancer cells to travel. Lower back. The spine is a central area where prostate cancer can metastasize, particularly to the vertebrae. This can cause pain along the back, often radiating From the lower back into the legs, hips, the pelvic bones, including the hips, are common sites for bone metastasis. Pain in the hip region may feel like aching or stiffness, and it can limit mobility. Pelvis. Since the prostate is located in close proximity to the pelvis, the spread of cancer to the pelvic bones can cause discomfort and pain in the pelvic area. The pain may also extend to the groin or thigh. When to seek medical attention. If you're experiencing persistent or worsening pain in your lower back, hips, or pelvis, it's essential to consult a healthcare provider. While many other conditions, such as muscle strain or arthritis, can cause similar symptoms, persistent pain, especially when accompanied by other prostate cancer symptoms, requires immediate medical attention. Early detection and intervention are critical in managing prostate cancer and preventing further complications. If the pain is related to cancer metastasis, addressing it as soon as possible can improve the chances of successful treatment and help prevent additional spread of the disease. Preventive measures and early detection. While there's no surefire way to prevent prostate cancer or its spread, early detection through regular screenings and proactive monitoring can help improve outcomes. Men who are at higher risk for prostate cancer, such as those with a family history or other risk factors, should consult their healthcare provider about when to begin regular screening. If you're experiencing persistent pain in your lower back, hips, or pelvis, don't delay seeking medical attention. While it may not always indicate cancer, addressing it early can provide valuable insight into your health and help catch any potential issues before they worsen. Loss of bladder control, a key sign of prostate issues. Have you been experiencing difficulty controlling your urination, such as leaks or dribbling? This common issue is often linked to prostate conditions and could be a red flag indicating something more serious, like prostate enlargement or even prostate cancer. Let's take a closer look at how prostate health is connected to bladder control and why it's important not to ignore these symptoms. The connection between the prostate and bladder. Control. The prostate is a small walnut-sized gland located just below the bladder and in front of the rectum. It plays a vital role in the male reproductive system by producing fluid that is part of semen. The urethra, which is the tube that carries urine from the bladder out of the body, passes through the center of the prostate. Therefore, any issue with the prostate can directly affect urinary function. As men age, the prostate can enlarge, a condition known as benign prostatic hyperplasia, BPH. This enlargement can compress the urethra, making it difficult for urine to flow freely from the bladder. In some cases, this can lead to symptoms such as frequent urination, weak urine stream, and loss of bladder control. However, it's not just benign prostate enlargement that can cause bladder control issues. Prostate cancer, especially in advanced stages, can also interfere with bladder function. Tumors or cancerous cells can press on the bladder or urethra, leading to urinary incontinence or difficulty controlling urination. How does loss of bladder control manifest? Bladder control issues related to the prostate may present in several ways. Some of the most common symptoms include urinary leaks or dribbling. One of the most noticeable signs is the involuntary release of urine, whether it's a few drops or a larger amount. This can happen while you're walking, coughing, sneezing, or even during activities like lifting heavy objects. Urgency to urinate. A strong, sudden urge to urinate, often followed by a loss of control, can be another indication that something is wrong with the prostate or urinary system. Nocturia, frequent nighttime urination. Waking up multiple times during the night to urinate is a common issue for men with prostate problems. In severe cases, men may experience nighttime accidents where they are unable to make it to the bathroom in time. Inability to empty the bladder completely. Some men report feeling like their bladder isn't fully empty even after urinating. This sensation of incomplete emptying is often caused by an enlarged prostate putting pressure on the bladder. Dribbling after urination. This occurs when urine continues to leak out in small amounts even after a man has finished using the bathroom. It may happen suddenly, or there may be a gradual dribble of urine. Why does prostate enlargement lead to loss of bladder control? As the prostate enlarges, it can press against the urethra, which narrows the pathway that urine flows through. This pressure can cause a range of symptoms, including impaired urinary flow. With the urethra constricted, it's difficult for the bladder to empty fully. This can result in incomplete voiding, urinary retention, or a feeling of urgency even after using the restroom. Weakened bladder muscles. The bladder muscles work harder to push urine out against the obstruction caused by the enlarged prostate. Over time, this extra strain can lead to bladder muscle weakness and a lack of control over urination. Interruption of nerve signals. The prostate is closely connected to the nervous system. When the prostate is inflamed, enlarged, or affected by cancer, it can disrupt the normal signaling between the bladder and brain, making it harder to control when and how urination occurs. Prostate cancer and bladder control. In addition to benign enlargement, prostate cancer can also disrupt bladder control. When prostate cancer spreads or grows near the bladder, it can press on the nerves or the bladder itself. This pressure can lead to incontinence or difficulty holding urine. Even in early-stage prostate cancer, issues such as frequent urination, urgency, and dribbling can emerge if the cancer affects the nerves or muscles around the bladder. Advanced prostate cancer that spreads to other organs or bones can also lead to a loss of bladder control, especially if it damages the pelvic region. What to do if you experience loss of bladder control? If you're experiencing any signs of bladder control issues, whether it's frequent leaks, dribbling, urgency, or difficulty emptying your bladder, it's crucial to consult with a healthcare provider. While benign prostate enlargement, BPH, is a common cause, other conditions, including prostate cancer, can contribute to these symptoms. Steps you can take. Consult a doctor. Your healthcare provider will likely conduct a physical exam and may perform tests like a prostate-specific antigen, PSA test, ultrasound, or a digital rectal exam, DRE, to assess prostate health. Keep track of symptoms. Document your symptoms, including how often you experience incontinence, urgency, or discomfort. This information can help your doctor determine the cause and severity of the problem. Follow up regularly. Regular follow-ups with your doctor are important to monitor any changes in your symptoms and manage the condition effectively. Consider lifestyle changes. Making lifestyle adjustments such as reducing caffeine and alcohol intake, avoiding overactive bladder triggers, and practicing pelvic floor exercises, Kegel exercises, can help improve bladder control. Explore treatment options. Depending on the cause of your bladder control issues, your doctor may recommend treatments such as medications to shrink the prostate, hormone therapy, or surgery to remove part of the prostate. If prostate cancer is diagnosed, a comprehensive treatment plan will be created to address the cancer and its effects on bladder function. Loss of bladder control is not something to take lightly. Whether it's due to benign prostate enlargement or a sign of prostate cancer, it's essential to address this issue promptly to preserve your quality of life and overall health. Regular screenings and proactive measures can go a long way in catching potential problems early and ensuring that you get the treatment and support you need. Unexplained weight loss or fatigue, a sign of advanced prostate cancer. Have you noticed a sudden drop in weight or an overwhelming sense of fatigue that doesn't seem to go away? These might seem like common issues, but when they appear together, they could be warning signs of something more serious, such as advanced prostate cancer. While they are often overlooked or attributed to other causes, understanding the link between weight loss, fatigue, and prostate health could help catch potential problems early. Understanding the link between prostate cancer and fatigue or weight loss. Prostate cancer in its early stages may not show many obvious symptoms, which is why it's crucial to be aware of more general, non-specific signs. Unexplained weight loss and chronic fatigue are two such symptoms that could indicate the progression of prostate cancer, especially if they appear suddenly and without a clear explanation. The connection between these symptoms and prostate cancer lies in the body's response to the disease and the ways cancer can impact overall health. As prostate cancer advances, It can interfere with the body's ability to function properly, leading to a range of systemic symptoms. Here's how. 1. Unexplained weight loss. Weight loss is one of the more concerning symptoms associated with advanced prostate cancer, and it's often more dramatic than just a few pounds. It's a condition known as unintentional weight loss, and it can happen when the body starts to burn calories more quickly or doesn't absorb nutrients properly due to the effects of cancer on metabolism. Prostate cancer may cause weight loss in the following ways. Increased metabolic demand. As cancer cells grow, they use up the body's energy reserves, leaving less for the body's normal functioning. This can result in significant weight loss, despite a normal diet and regular eating habits. Loss of appetite. Prostate cancer can cause nausea, digestive discomfort, or a loss of appetite, leading to decreased food intake and unintended weight. Loss, malabsorption. In cases where prostate cancer spreads to other areas like the bones, liver, or lymph nodes, it can impact the digestive system's ability to absorb nutrients properly, causing further weight loss. Hormonal changes. The body's hormones, including those that regulate metabolism, can be disrupted by prostate cancer. This hormonal imbalance can lead to weight changes. If you've been losing weight without trying, it's important to bring it to the attention of your healthcare provider. This could be a sign that your body is fighting something more than just aging. 2. Chronic fatigue. Fatigue is one of the most common symptoms experienced by individuals with advanced cancer, including prostate cancer. It's different from the normal tiredness everyone experiences from time to time. Prostate cancer-related fatigue is persistent and doesn't improve with rest. It's often described as a feeling of being overwhelmingly tired, even after a full night's sleep. Here's why fatigue is a hallmark symptom of advanced prostate cancer. Cancer-related metabolic changes. As prostate cancer progresses, it creates cancer cachexia, a syndrome that leads to weight loss, muscle wasting, and overwhelming tiredness. This is due to the body's response to the cancer cells, which demands more energy and reduces the efficiency of how the body uses nutrients. Spread of cancer to other organs. When prostate cancer spreads, metastasizes, it can affect various organs, including the bones, liver, and lymph nodes. This may disrupt normal bodily functions and contribute to fatigue due to increased stress on these organs and tissues. Anemia. Prostate cancer can sometimes lead to anemia, a condition where you don't have enough red blood cells to carry oxygen throughout your body. Without adequate oxygen, your body can feel constantly fatigued and weak. Treatment side effects. For those undergoing prostate cancer treatment, including chemotherapy, radiation, or hormone therapy, fatigue is often a side effect of these treatments. It can leave patients feeling exhausted and drained. When should you be concerned? While weight loss and fatigue can be related to many health issues, it's essential to pay attention to how sudden and unexplained these symptoms are. Losing weight without dieting or changing your lifestyle, especially when combined with ongoing tiredness, is not normal. If you experience these symptoms alongside other prostate-related signs, such as frequent urination, blood in urine, or pelvic pain, it may be time to seek immediate medical attention. What should you do if you experience these symptoms? If you're experiencing unexplained weight loss or persistent fatigue, it's crucial to consult a doctor. Your healthcare provider will conduct a full evaluation to determine the underlying cause of your symptoms. This could include a thorough physical exam, blood tests like PSA testing, imaging tests, CT scan, MRI, ultrasound, or even a biopsy to check for cancer. Monitor your symptoms. Keep track of any other changes in your body. Do you have unexplained pain, changes in urination, or difficulty with sexual function? These could all be important clues that help your doctor with diagnosis. Get screened regularly. If you're at an increased risk for prostate cancer due to family history or age, talk to your doctor about regular screening. Early detection can make a significant difference in managing prostate health. Consider lifestyle changes. Eating a balanced diet, maintaining a healthy weight, exercising regularly, and managing stress can help improve your overall well-being and may reduce the risk of developing prostate issues. Seek emotional support. Chronic fatigue and weight loss can take a toll not just on your physical health, but on your mental health as well. Talking to a counselor or joining a support group can help you cope with the emotional side of dealing with health concerns. Unexplained weight loss and fatigue may seem like mild concerns at first, but they can be warning signs of something more serious, including advanced prostate cancer. It's essential to listen to your body and seek medical advice if you notice these symptoms. Early detection and prompt treatment can help manage prostate cancer and improve outcomes, making it crucial to pay attention to your health and act quickly when needed. Final thoughts. Recognizing the early signs of prostate issues could be the key to safeguarding your health. Whether it's frequent urination, pain during urination, or unexplained weight loss, these symptoms may seem insignificant at first, but they could be a warning signal that shouldn't be ignored. By staying informed and attentive to your body's changes, you can catch potential prostate problems early and take action. Regular checkups, awareness of these signs, and prompt medical consultation are crucial steps in ensuring your long-term health. Remember, knowledge is power. Empower yourself and those around you by sharing this video. The more we understand our bodies, the better equipped we are to address health concerns before they become serious. If you notice any of these symptoms, don't wait. Reach out to your healthcare provider and discuss your concerns. Thank you for watching. Make sure to like, share, and subscribe for more valuable health content. Stay proactive about your health and take charge of your well-being today. Always consult a healthcare professional for any health-related concerns. The information provided here is intended for general awareness and should not replace professional medical advice.